But the question I have for both of them with, let's say, stem cell methods or any other method, how's success measured? How's productivity and neuroplasticity measured? And, what's been the results thus far?
Halland, I think you're on mute.
Sorry, there you go. I'm gonna do one component of it. So one way that it's measured. So for example, if you guys want to Google a clinic called Aviv, AVIV, they are very well known for treating people with dementia and strokes and things like that. And it uses hyperbaric technology. And so the first clinic was in Israel. They are now building one here in New York City. And they actually have the only other center in the US in Florida because they basically wanted to be in the world's largest retirement community and happened to be in a place called the Villages in Florida. And so they do a bunch of cognitive battery testing. So they measure, I mean, they even measure your brain scan, they measure areas in your brain, how active they are. And so they actually will have functional scores pre and post hyperbaric. So they do a 3-month program. It's pretty intensive. You go every day, 5 days a week, like 3 hours a day for this whole training program. And, there's various reasons why people are there. Some people are there for dementia. Some people are there for, like, for example, I had a client very severely injured, so we needed the hyperbarics to help heal the body. So there's a lot of cognitive testing so you can do. So that's really the score line. I mean, I don't know. This might be, more for Thorne to answer if there's ways to measure like actual activation or neural pathway or whether nerves are growing. But usually from people who have experience neuroplasticity or getting the benefits of it, there's a score that's changing from a test.
Thorne,
Yeah,
what
that's
about you?
awesome. Yeah, I tend to look at the measurement piece as a spectrum. So as an example, you have essentially qualitative measures. So that could be like a brain health index, and then successive quizzes and things of that nature you can do, which again is all based on self-report. That's kind of the gold standard for a lot of this. But that's quickly changing, to Holland's point. And I think you get into more advanced measurements. So then over here, maybe you have like, things like quantitative EEG and neurofeedback. And that's something that we're seeing, as a more advanced measurement, essentially. And then way over here, you also get into what are called brain-computer interfaces. So one of my advisors, Dr. Galen Buckwalter, qualified for a clinical trial at Caltech. He just got 6 neural arrays implanted on his brain, including one in the prefrontal cortex, the first time in history. And it's specifically the BlackRock Neuro Utah array. And what this is doing, though, it's measuring the brain activity, but then it's also allowing for excitation of literally of essentially neurons. And so really interesting. And so what we're seeing is really that spectrum. And so it depends on the human and where they're at. And our vision is to give away the software, reach 1 billion humans. That's really going to be on self-report. You've got BCI, brain-computer interfaces over here. And in the middle, you have things like, again, EEG, QEEG. So it kind of just, it depends on the budget of the human and also really what their outcome, what the outcome they're looking for.